Maybe born with asphyxia, asphyxia, with a class 4 of 7 over 10, and we are going to carry out resuscitation.
That's where we.
Before we carry out the resuscitation, we have to make sure the environment is conducive. The nearby windows have to be adjusted, the door is closed. Then also, before me here, we have the equipment. We have here the sterile gloves, also examination gloves are here. And then we have the normal saline, the D50, yes, we shall need to make 10%. We have the adrenaline, a thermometer, we have a hydrocortisone here, syringes, we have the cannula, we have the ampicillin, a gallipot containing sterile cotton, sterile gauze, also, and the arm bag, which is functional. We have the mask here. There are two. We shall see whichever fits our baby. And we have a receiver here for receiving the secretion. The gallipot containing cold water. Also a clean green sack in a gallipot. We have the thermometer. And then the stethoscope. Also, we have extra linen here, which are cotton, which are warm enough. And yes, we shall need it more. So, in baby resuscitation of the neonate, I'm grabbing myself with disinfection. Then in the resuscitation of the neonate, this baby will open, but also to make sure, we have to make sure this baby is provided with it, baby is kept warm. And we are going to dry this baby. I'm going to dry this baby. But we first open quickly for examination. Then you dry the baby from head to toe. And in drying, you have to go in circular movement. At the same time, you will be observing this baby as well stimulating this baby. Then turn the baby to the back. Also, at the same time, you drive as well as stimulating this baby. Again, moving in it, circular. So, also, we have to change this wet clothes which we use for receiving the baby. But you make sure you don't expose this baby. Run on this side also and dry. At the same time, while changing this wet linen from the baby so that we provide our baby with it warm. Afterwards, you have to clean the what? You have to clean the baby's the what? The eyes. Here. This one. Then the mouth. Don't enter, then apply the first press it, enter the mouth, you change this baby, get the secretion, put the receiver, get the water, clean, go to the vestries, receive, clean, go to the next nostril also, clean, and clean the skin. Afterwards, also we have to feel the cord. The cord is pulsating. The cord is pulsating. Then we position this baby for the resuscitation. Make sure the baby faces for proper access on the airway. But make sure the step is warm. Then we have to go with this baby one. Extend the head so that you can access the airway. At the same time, you can add on this. That our baby but to make sure you expose the chest big so that you can observe chest movements. Afterwards, the mask fits our baby. You try, keep on try. This one does not number one, it's the baby. Then I connect it to Ampa. But you have to just like function. So apply the mask. Apply the mask. It has to cover both the mouth and the chin. This finger supports the mask. This one here, then the three fingers support the chin. So, as you're bagging, you have to observe the chest movement. So you have 1, 2, 3, 4, 5. After, go and do the chest compression. Use 2 fingers to go firmly. 1, 2. Afterwards, feel the cord. Then also, just do respiration. Repeat the same while preventing what? Repeat the same procedure ratio of 5 to 2. Make sure you cover both the mouth and the okay. 1, 2, 3. While observing the chest, I see the already chest movement. 4, 5. Go to the chest. 1, 2. Assessment. After that, if the airway seems not to be clear, you can resuck this baby. But for the case of our baby, the airway is clear. I see the chest movement. Baby has started breathing. Even now, breathing well and even crying. And on the assessment, I see that the score has come up to 10. Even the baby is crying. Baby is crying. breathing well. So I can now take the baby to the mother for skin to skin and also initiation of breastfeeding. Thank you so much.